Welcome to Healthier, Happier You, the people working to make it happen. I'm Evan J. Cholfin from Luxhammer, where we help the brands that help you live healthier. Today, we're joined by Gary Skole, founder of AlzBetter, who's revolutionizing dementia care through their comprehensive Dementia 360 program. Gary, welcome.
Hi, Evan. Thanks for having me.
Glad to have you. So, what inspired you to create AlzBetter and the Dementia 360 program?
I get asked that question a lot. Really, where this came from was, for the most part, a mistake or a screw up. I started my home care business in 1989 and had been running a home care, senior care business in New Jersey for over 20 years. And we had a case that had come into us, which should have really been a very easy case for us to manage. The daughter described it as her mother is a sweet little old lady with Alzheimer's, and she wanted us to stop her from shopping because she was going out and buying things and hoarding them. And that was the whole job. And it was a 24/7 job. So it was an around the clock case that we had, which is sort of the home run in the home care world. We were taking care of this lady, and this sweet little old lady went through a dozen caregivers in a matter of 2 weeks because when we tried to tell her, no, you can't go shopping, she wasn't such a sweet little old lady anymore. Nobody wanted to stay there. She kicked everybody out and got very agitated and aggressive, and staff was threatening to quit in the office because they were tired of replacing people. And the daughter went to the referral source, which is where we get a lot of business, and said, hey, why did you refer this company? They don't know what they're doing. It was at that point that I said, I better figure this out. And, at that time, we were treating our dementia clients the same way we treated everybody. If you had a stroke, if you had cancer, if you had anything else, you got the same assessment, the same care plan and everything. After doing a little bit of research, a light bulb went off and I realized that I had no idea what I was doing, but I didn't know, as most people don't. They assume that dementia can be tough, and those that are tough, we simply can't manage, and they end up going to a nursing home or some kind of facility. And those that we can manage, we manage. After learning this, I tried to find some home care related training for my staff, and I just couldn't find anything that I felt was easy enough for them to learn that was home care centered. So I ended up just creating my own stuff. And what I realized later on was that I wasn't alone in my lack of knowledge. Nobody else was doing a whole heck of a lot better than me. And these are people that you think would. Primary care physicians really aren't trained in how to manage those living with dementia, at least from a non-pharmacological standpoint. Medications, even to this day, are not super helpful unless it's caught very early, and then they're very expensive and they aren't really all that great yet. So the physicians aren't really very knowledgeable, which is where the families usually turn to first. Healthcare organizations, insurers, managed care, they don't really know a whole heck of a lot. Hospitals are calling us asking, how do I manage these patients when they're trying to transition them from an emergency department into an admission because they don't know what they're doing. The home care companies that on their website say, we know what we're doing, call us, don't really know what they're doing. So there was this gigantic market out there that didn't know how to care for people living with dementia. And that was really the impetus of maybe there's an opportunity here to help these other organizations do a better job than I was doing. That really is what kicked off AlzBetter.
Wow, that's amazing that you did, and you're helping a lot of organizations, so that's fantastic. That mistake turned into something amazing, so I'm glad it worked.
Yeah.
So what makes your approach to dementia care education unique?
What we learned was that dementia is really, really challenging. It takes years and years of doing this type of work to start really understanding it and to become good at it. When we started trying to train these other companies, there was a couple of things that would happen. One, we would start training somebody that we would call a champion for that company, somebody that kind of owned the dementia side for that business. And then if that person quit, the whole program fell apart and they went back to square one. If they had to hire somebody, it would take months and months and months to train them up. It just wasn't working very well that way. So what we learned was that we had to simplify the process. We had to take this very complex situation and try and figure out how do we make it a little bit easier. So the first thing that we did was we created these little micro learning lessons, and we call it actionable education because the idea here is that we can identify where the need is. Mrs. Jones is wandering, and that's the major issue we have to deal with. And if we're sending somebody out to care for Mrs. Jones who is wandering, we don't really need to teach our caregiver how to get her to bathe because Mrs. Jones bathes fine. We don't need to teach her how to get Mrs. Jones to eat because she eats okay. But what we need to focus on are the issues at hand here. We dissect the case to say, okay, what are the main issues and how can can we get our caregiver up to speed in the easiest, shortest manner? We do this assessment, and then we created these lessons that we can send out via text message or via email. Nothing to download. So the case manager can say, okay, here's the issue. Here's my caregiver, or here's the family member. I'm going to send them something. They just click on a link, and now within 5 minutes, they have a much better idea of this is how I manage this very challenging situation. That was the first thing that we did that was really very different. We found it incredibly useful because in the home care world, there's a very high turnover rate. As much as 70% of the caregivers don't make it more than 90 days. Even if you could invest in training these caregivers, the chances are 7 out of 10 are going to be gone in a short amount of time. So agencies are trying not to invest quite as much up front. And this way they don't have to. They can do some training up front and then identify and target the areas that those caregivers need to be trained. And that seems to be working a whole lot better. The other issue is that when we do try and train anybody, not just caregivers, but I don't care really who you're trying to train, if you train them for hours and hours, which most typically happens during orientation, we give them 8 hours of videos or lessons. The reality is if they retain 10% of that a month from then, we're lucky. TED Talks, which are some of the most brilliant people in the world, are limited to 18 minutes because those geniuses stop retaining information after that amount of time. So how can we expect to train our staff by just dumping all this training on them and saying, okay, now you're good to go? So we really believe dissect it, send out these little lessons, make it very easy for the individuals to use those lessons. And it's a much better way to do this. It's mobile friendly, it works on a computer, works on a cell phone, works just about anywhere. That was the first piece that we did. Then what we've done most recently is we've incorporated, I guess, like the rest of the world, AI. And what we are now doing is taking that a step further where that company that doesn't necessarily have 15 years of dementia experience in their individuals to lean on, well, maybe now they don't need it because what we've done is we have trained our own, we call her Abby. Abby is our AI tool. And we have trained Abby using documentation that we've written. So now it's called a closed system. Abby, when asked a question, will go into our data and look at our information, not just scour the internet and maybe come up with a good answer, but maybe hallucinate. Abby's going to look at our information first, and we can put all kinds of scenarios in here. Now, the individuals, whether it's a care manager or a caregiver or a family member, when they don't know how to deal with a very challenging situation, they can ask Abby. 24/7, they've got this support system of this dementia expert literally in their pocket. It's really, to me, revolutionizing the way that we can support these individuals. They don't need to call the agency at midnight and maybe this person knows what they're doing. Maybe they're annoyed you're calling them. They can handle a lot of this stuff on their own. Empowering the families, empowering our caregivers is really what we want to do. They feel more confident in what they're doing, whether it's a job or caring for a loved one. And it becomes less stressful when they're doing it that way.
So, what aspects of the program are showing the strongest results?
Right now, the managed care organizations that are using our program, the hospice and Medicare companies that are using our organization are primarily using what we call our targeted stress assessment to identify where the issues are and then sending the lessons to the individuals. But I think what you're going to see more and more is kind of a blended combination of both of these things. Because again, as we start to get the app into the hands of the users, I think you're going to see more people going into Abby and just asking those questions and saying, how do I deal with this particular situation? Because she can really drill it down into helping them for that. So as of now, it is the sending lessons, what we call them, the targeted stress assessment and sending lessons. But we do think that Abby's going to be a very big part of that.
Yeah, definitely. Who benefits most from your technology based approach?
At this point, it's a business to business model. So we are working with managed care organizations. We have some of the largest in the country that use this because, again, they struggle with dementia care. If you look at it from a dollars perspective, the living with dementia are much more expensive than those not living with dementia when those individuals have a comorbidity or a secondary condition. Those secondary conditions are much more expensive than somebody that's not living with dementia. So it just makes sense for the managed care where they're trying to save as much money as possible. It makes a lot of sense for them to try and support this population. But we've begun working with the VA as well because veterans have a much higher rate of dementia due to head injuries and PTSD than the non-veteran population. Again, you've got this population that is maybe challenging, and veterans have their own special and very unique needs. So we've created a special training specifically for veterans living with dementia. How do you manage that population? It's really anybody that takes care of seniors. We're in assisted living communities, home care communities, hospices. And there's a new Medicare program that recently came out called the Guide Model. The Guide Model has a lot of potential because it's one of the first programs that is specifically paying through Medicare for companies, physicians, and healthcare providers, and they're partnering them with what we call navigators, which is the non-clinical person. It's putting all that together, and it's really the first Medicare program to help with dementia. But in order to use that program and not lose money off of it, you have to be very efficient. So our program is really beginning to get adopted by these organizations because of the technology, especially with our mobile app. Their navigators can, in seconds, send lessons and support individuals, the family members, where in the past it may have taken them a half hour to an hour to get all this information together. In seconds now, we can help them give the correct information. Plus, if they give the families access to this app, the families, as I was saying, now have access to all the lessons that we have, plus the AI piece that is there with Abby. So the Medicare model is beginning to use this with the Guide Model, and we think that's going to be a really successful place for us.
So, changing topics a little bit, what's been your biggest challenge in expanding AlzBetter this year?
I think it's really just getting in front of enough people to let them know we exist. Doing podcasts like this is certainly a great avenue, but I would say that we're really good at developing our program and our product, and we could always be better at getting the word out and communicating. So I would say that the biggest challenge is just a lot of noise out there. You're competing with a lot of people, especially because what we have is an app. We don't consider our app truly an app because most of the times apps are you just download it and you use it, but this is actually a tool to really have a whole dementia program in your pocket. But it's really getting the word out and trying to communicate that to enough people, I would say, is our biggest challenge.
Yeah, how do you address that challenge?
Well, through social media, through going to shows, getting tables, speaking at events, really anything we can do to network and to get the word out. When we are lucky enough to do a presentation to a company, they almost always purchase our product. We know we've got a great product. It's a challenge is just getting enough people to get in front of to present that to.
What aspects of your platform would you like to enhance?
Well, we're continuing to work on the AI side of things. I am blown away when I see the things that can be done with AI, and it just never, ever ceases to amaze me. It gets smarter literally every day. The problems that we're hearing about, the hallucinating and some other issues, are getting less and less. I kind of equate where we're at with AI to where we were maybe 20 or even 30 years ago with the internet, where we had dial-up modems, and you're lucky if your web page that you wanted to go to came on, and designing a web page was a nightmare. Everybody knew it was going to be big. And the reality is when internet goes out, we're all in a panic now. We really can't live without it. I think AI is where the internet was 20 or 30 years ago. It is so amazing, but still so raw and still so unknown. 5, definitely 10 years from now, we're not going to be able to live without it. The things that it's going to be able to do for us, and hopefully everything will be safe and the world will be under control with the use of AI. We're working on some programs right now that are going to help people with mild cognitive impairment and early stage dementia. So mild cognitive impairment, you have some cognitive issues, but not enough that you necessarily need a caregiver and you can't live on your own, but you might still need some help. Same thing with early stage dementia. And one of the things that we are really trying to do is to enable those individuals to remain independent as long as possible. And we have some things in the pipeline that I think are going to be just fantastic for keeping those individuals living on their own, or even if they're living with a spouse, to give their spouse a little bit of a break for as long as possible. If you have mild cognitive impairment, you may never end up with dementia, but you'll always have some sort of cognitive impairment. Again, our goal is let's keep that person, because that's what they want. They don't want to have to go into a home or an assisted living or anything like that. If they can live as independently as possible, that's their goal. And that's what our goal is to help those individuals do that. Not only that, we work with developmentally disabled adults as well with our AI tool. We actually have a tool that helps them prepare for job interviews. So helping these adults learn how to interview properly for a job. They can practice using our avatar that we've built for this. We can help them in all different ways with learning socialization skills and things of that nature. So the opportunity here is unbelievable. It's really amazing and tip of the iceberg right now.
It really is. What are your main growth targets for 2025?
We're really pricing the app in such a way for businesses that it's almost a no-brainer. We really want to be able to get this into their hands so that they can begin using this more. Once they use it, they love it, and it is just so beneficial to them. Like I said, they typically don't know a whole lot about providing this type of care. So this enables them to be much better at that, whether it's a return on investment you're looking for or just to provide better care. I think that using our app is a great tool. Really, our growth target is how do we get the app into more hands? And that's our number one goal.
Which healthcare segments are you most focused on expanding into?
That's a great question. We probably have this conversation once a week because we feel there's just so many markets for us. The managed care world is a great fit. It just tends to move a lot slower, so it could take sometimes years to get through to the right people there. The guide model is really just a great market for us because we're such a good fit for that, as well as hospice. A very large percentage of people on hospice have a cognitive impairment, and again, being able to provide families or the hospices a better ability to care for those individuals. Those are all real growth markets for us. Home care is my background, so I truly believe that we can really help those home care agencies provide better care, but 30,000 home care agencies all competing with each other. How do you stand out? How do you separate yourself from everybody else? Well, one way is to be a great dementia provider because there's just not a lot of them out there. This tool would enable them to take a step forward towards being a better dementia provider and therefore standing out in this very crowded market. One other place that we haven't gotten into yet that we'd love to is EAPs. There's very large businesses out there with tens of thousands of employees. And what they found is that when the employees have a parent that's living with dementia, that employee is kind of half there. They might be taking mom to a doctor's appointment. They might be taking 10 calls a day from mom when she keeps calling and she doesn't remember she called, or the caregiver didn't show up today, or any of those types of things. We think that employers can really assist their employees to be more present while they're at work and to get rid of some of that stress by learning how to manage a loved one and support a loved one better that is living with a cognitive impairment. So certainly the EAP market's another place for us to be.
So, what's working best in your outreach to facilities?
Really getting out there and demoing it. Even with the facility market, we have a whole new system in place. Facilities also have a higher turnover rate than normal businesses do. Just like home care, there's a higher turnover rate with CNAs and their whole staff. So we really want to help educate their staff. When we show up there, we say, look, because we also have an entire learning management system as well that we've developed. We're talking about a facility, the CNA, the certified nurse's aide, or the nurse. We have training through our learning management system for them, but we really need to take it beyond training. And that's where that actionable education still holds true, because we're not going to give them 8 hours of training up front and have them now become dementia experts. What we're developing is kiosks that we can put on the floor that they can work with while they're on the floor, and they can ask questions of our AI and say, hey, I have this situation. How do I manage that? The combination of the LMS training during orientation and maybe on an ongoing basis with the actionable education is going to empower their staff to do better at caring for this very challenging population. So when we show them that, they love it. And that's really almost the sales pitch right there, just showing it to them.
Yeah, seeing is believing, right?
It really is. I think that healthcare in general, it's really just been the last 5 years or so that all of a sudden innovation is accepted, where in the past, I think it was always, this is how it's done, and we kind of stick with the old ways. Now it's gotten so expensive and there's such a shortage of labor that they're much more accepting of innovation, which is great for us because we love to innovate here. So really, I think that innovation is going to play a huge role in healthcare moving forward, and the openness of the younger generation, the new doctors, the need that's out there. I think it all plays into where we're going with what we're doing. I would love it if there was no need for dementia services, but I don't see that ending, unfortunately, anytime in the near future.
What partnerships are crucial for reaching your goals?
Working with various associations is important. As an example, the Home Care Association of America, I'm a member of, and I was a committee member there for quite some time. We work closely with the NCCDP, which is the National Council of Certified Dementia Practitioners. Right now, we have put a course together to train nurses, and it's really the first of its kind where we are focusing on clinicians, primarily nurses, nurse practitioners, and teaching them how to care for people living with dementia because there's not a lot of clinical support for those individuals. There's lots of training out there, but we really break it down into what medications might you need to either look at or more likely remove or think about, what comorbid conditions might be affecting why this person is acting the way they're acting. When you take a clinician and you put them together with a non-clinician that's experienced in this, that's really the best of both worlds. And again, using Abby, we can train Abby now that we've written this information on how a clinician can manage somebody living with dementia. So that's really the next phase also of what we're doing, getting this into the hands of the clinicians so that they can better understand how to manage that population.
What trends in dementia care technology excite you the most?
Again, I still think that AI is going to just be a game changer in all of healthcare, but definitely with dementia care. There's so much going on right now when you're talking about trends. We're just starting to get a better understanding of how to support these individuals. We're creating better environments for them, things such as focusing on lighting and sensors and some of these new technologies that are out there that are not invasive, that understand that you need to make sure you have the right lighting to make sure circadian rhythms are right so that people don't trip and fall, which is the biggest reason that they end up in the ED and they end up going into the hospital. And somebody living with dementia in hospitals typically don't do all that well. So, and then using sensors as a way to maybe track what's happening. Is the person getting up more often? Do they have a UTI? Are they using the bathroom more than they should? Are they checking their fridge? All that kind of stuff. Using cameras, using all of these things together, really having a smart home of sorts is going to play a major role in keeping people safe, keeping people home, and understanding when we need to get more involved. I don't think the labor shortage is going away, so technology is going to have to play a major role in managing individuals more with less human interaction. It'll never replace the humans. We still need humans, but I think it's going to play a bigger.
Are you seeing that on your side in terms of labor shortage, or is that more on your client side?
We have a small company here, so labor is not an issue with AlzBetter, but I also happen to own a home care company, and that's where we test this out and we get it in there first and we make sure we're doing everything right. I will tell you that labor has always been an issue, but in the last 5 years, it's really become the number one issue. It's become critical because we just can't get enough good caregivers that are out there. And certainly when you're talking about dementia, enough good caregivers that are trained well enough to provide the kind of care that we would love to see.
So, for the business, what do you think is going to be crucial to get right in the next year?
We're in such an uncertain environment from a business perspective. As an example, we work with the VA, and is the VA going to have funding cut? Are they going to be okay with that? It's a little bit uncertain as to where things are going. But I mean, the opportunities are countless out there for us. Again, unfortunately, dementia strikes everybody, and because it's just so challenging, there's just not a lot of people doing it well. I just think that no matter what the environment is, I think we're going to be okay.
So, on the flip side, what would make 2025 a breakthrough year for AlzBetter?
Really, the adoption of using our technology, of getting it into more hands. We're very close to getting into some big players. And I think that that's really what we're looking for. We have a unique product that nobody has, and it really works well. I think that you take all the dementia that's out there and the lack of good care and the lack of products, I think we're well positioned. So I think 2025, it's started off to be a good year, and I think it's going to end up being a really good year for us.
That's great to hear. That's it for today's episode of Healthier, Happier You, the people working to make it happen. Thank you to
Thanks,
Gary
Evan.
Skole
Uh,
for sharing.
if
Yeah,
anybody needs to find us, we're at alzbetter.com. That's ALZbetter.com. So love for people to come on.
please do. Please visit. Thank you for sharing how AlzBetter is transforming dementia care through technology and personalized support. If you enjoyed this conversation, make sure to subscribe and leave a review and share it with someone who could benefit. If you're a brand or business making impact in health and wellness, or personal care, we'd love to help you grow. Connect with me at luxhammer.com. Thanks for listening. Until next time, stay healthy, stay happy, and keep making a difference.
Thanks, Evan.
Thank you.